Hey everybody, welcome to the September newsletter video. September's newsletter is back to school, so we're going to talk about back health. Here is a human spine model, so we'll talk about some anatomy real quick, just to remind you. Then we'll talk about back pain and things that cause back pain and things to prevent back pain. So real quick, as a reminder, the top portion of your spine, you have 7 cervical vertebrae. So vertebrae is a backbone, like in things in your spine. So 7 cervical, you have 12 thoracic, and then you have 5 lumbar vertebrae down the bottom. Below the lumbar section is your sacrum. There's a couple bones there, but they're fused together. They act as one bone, and below the sacrum is the coccyx. Same thing, couple bones fused together, basically acts as one bone. Cervical, thoracic, lumbar. So as you can see, we have the model here showing the discs to allow forward side flexion. So speaking of movement, as you move your body forward, when you forward bend, about half, so 40% of your ability to move forward is from the mobility of your lumbar spine. The other half, or 40% give or take, is from your hips. So hip mobility and lumbar mobility give you the ability to move forward. So you need to make sure you take care of both of those if you want to have the ability to bend forward. Back bending, however, comes from that thoracic section. So about 60% of your movement backwards comes from this area, your thoracic spine. So forward, backward bending, a lot has to do with back and spinal mobility. Before we talk about low back pain, let's talk about what maintains your vertebral column in position. You see the model here with the discs. A lot of people are like, oh, I have discs, they're keeping, Well, the discs are mainly articulation spots, so places for those joints to bend and, bend forward, bend sideways or whatever. The real thing that keeps your vertebrae in position is intra-abdominal pressure. So if you think of a soda can, I like to use that analogy. If you have a full soda can, step on it on the ground, it will actually hold your body weight, right? Because it's pressurized, there's no leaks or anything like that. If you open the soda can and then step on it, now there's a hole for that pressure to leak out and it won't hold your weight. So intra-abdominal pressure holds the spine in position, specifically while it's moving, and more specifically, or more importantly, when you're lifting heavy weights. If you can maintain and create and maintain intra-abdominal pressure, now you can keep your spine in the right position. If you don't, now you're going to rely on these discs to do something that they're really not intended for. They can, but their main job is just to kind of be a joint. Now, if you're asking them, well, hey, I'm not maintaining this intra-abdominal pressure, now the discs are like, okay, well, I'll do my backup job. So if you're relying on the backup, you're just setting yourself up for back pain. So what is our can? So the top is your breathing or your respiratory diaphragm. The bottom is your pelvic floor. The front of the can is your abdominals, and the back is your spinal muscles. So the ability to pressurize your intra-abdominal pressure and hold that is super important for to prevent low back pain. So that's one of the things there. Speaking of low back pain, taking the model off here a second, and let's zoom in. As the model bends, we'll go back and forth here like this. You can see where the vertebrae meet. So that's another joint there. That's called a facet joint. So where the overlap vertebrae are, it's called a facet joint. Most low back pain is a product of some type of facet joint irritation. We're going to take a look at a zoom in picture here to get a better idea of what facet joints are. Here we are zoomed in to the back view and side view of the spinal model. The arrows are pointing out the disc as well as the facet joints with arrows and red circles. As you can see, a facet joint is the gap between a vertebrae and the vertebrae either above it or below it. The importance of a facet joint, as I mentioned previously, is that common low back pain source is irritation of these facet joints. Facet joint irritation can often be remedied through exercise or, in some cases, manual therapy.